Hi, thank you for meeting with me today.
No problem at all. I look forward to hearing what you have to say.
I wanted to speak to you about Texas Senate Bill 203. I find that this is an outgoing problem, and with your support, we can learn to change the culture of our hospital for the greater good.
Please proceed.
Healthcare-acquired infections are a true cause of increased hospitalization stays and deaths. They continue to cause havoc on patients and can greatly be reduced with proper support from a reporting system for healthcare facilities to report healthcare-acquired infections to the state health department.
Yes, HAIs are always an area we need to improve. A bill that is towards helping our patients and saving money sounds like something our hospital needs.
This bill would affect the healthcare departments from hospital to emergency clinics and would most greatly affect patients that are immunocompromised. When a patient gets an HAI, it most often comes with prolonged hospital stays and therefore increased cost. In the year 99 alone, $1.7 million was spent related to HAIs and increased cost.
I see you mentioned education and training for staff. Would there be standardized training for employees?
Texas Senate Bill 203 will aid in reducing HAIs by providing a set standard across the state of Texas for healthcare facilities to base their practice and report infection rates, cost, and meaningful data. A healthcare department continues to strive to prevent HAIs on their own. We continue to develop multi-resistant organisms, or MROs. The implementation of multimodal prevention strategies require behavioral and cultural change. Texas Bill 203 will aid in long-term reduction of HAIs rates by providing the required cultural change needed in healthcare through set standards and reporting systems.
And are there currently any groups that are supporting this bill?
Key stakeholder groups for 203 include Care Quality Commission, Department of Health, Faculty of Intensive Care Medicine, and Health Protection Agency, just to name a few.
So far, I really like what I've heard. This would greatly help our hospital as well as hospitals and patients statewide.
By educating staff and training them properly, HAIs will reduce hospital stays, and decrease healthcare cost. We can put the money to greater good by advancing technology to help healthcare evolve with the system around us. Texas Bill 203 needs your support for funding of statewide reporting healthcare-acquired infections. 203 will aid in reducing HAIs by providing a set standard across the state of Texas for healthcare facilities to base their practice and report infection rates, cost, and meaningful data. As a nurse leader, I recommend educating staff on the implementation of the bill, as well as gathering data on HAIs and cost over the last couple of years and increased rates in MROs. Required education and training on how to decrease HAIs, from simple proper hand hygiene to which cleaning agents kill which strands of MROs and AMRs. With incorporation of Bill 203, the proper education and training of healthcare cost team, we can spread the word, not the germs, and help to save lives and reduce healthcare cost.
Well, I must say you have my support.
Thank you so much for your time and your support.